in order to be able to do our work most effective way possible. What that does is introduces additional risks.
Hi, Dr. Amel. Welcome to the podcast of Humans of Globe. We are glad to have you here today.
Thank you so much. It's a pleasure being here.
Yes, and your recent feature with us in the Germany's influential leaders who are driving clinical and MedTech excellence in 2026 has brought out something very profound in your journey. Your pursuit of protecting the clinical care integrity shows your commitment towards patient safety as well as your care about the clinicians around it. Today, I would like to know more about the human work behind this whole feature, behind those restless hours in the hospital corridors, and also it your current consulting firm, the kind of environment that you are creating for the innovators and the way that you are paving for them. It's all about it today. Welcome again. How are you doing?
Thank you so much. Doing better again. I was sick for a few weeks. Just came back from Dubai. It was an amazing time,
Uh-huh.
but got sick on the road. Now I'm up and running again, full throttle forward.
You're back from Dubai? Like what time?
We were in Dubai at MedTech World Middle East just 2 weeks ago.
Uh,
It was a great adventure. Luckily, we made it home safe just before the trouble started. So on that note, wishing all the best prayers and safe return and safety for everyone in the region.
right. It's ironical that we are seeing this in this generation wherein wars were something we never thought of, and hospitals, doctors, all frontline workers here play a very important role from the kind of environment which has been there. Hope this gets better soon, and glad that you came in at the right time. So cool. Let's start off by first thing here that first, yeah, we are safe. I'm somewhere glad that I'm talking to you here today. And the feature that has been done with Humans of Globe, that's something which I would really like to understand. How did this made you feel, and what was your reaction towards the first published story of it?
Yeah, of course, it was a great honor to be invited for this edition, specifically for the cover story. For me personally, what it meant is that there are people who really value what we do in MedTech more than just the industry part and more than just the business part, because everything about me or everything about us, Evomed included, and our whole team is pretty much about what you mentioned. Healthcare in the end is for humans, not for business. It isn't there to help people make money. It's not there to create tools who are impressive. So medtech tools which are impressive, but don't help anyone. In the end, what it is, it's about humans. It's about helping others. And for me, that feature meant that this is recognized more than just the surface level business advice, that there's more to it, to the whole human side of medtech. And yeah, it makes me very proud.
We are glad that you are here with us, and that's what makes Humans of Globe a platform wherein like-minded people can come in and all the leaders share their ideas to the world and the wisdom that goes on. So, would you recommend Humans of Globe as a platform for leaders to share their stories? How was your experience around it?
I would say yes, because there's one thing which is different with Humans of Globe in comparison to the other platforms that I usually get features on. The other platforms are very focused on MedTech. But in the end, MedTech is a very narrow niche. So what helps to connect cross industry and also to have bigger reach is indeed a platform like Humans of Globe, which is not industry specific, but features multiple industries, opens more opportunities, more doors. It is really a welcome differentiated platform.
Thank you. Uh, Again, from the platform perspective and from the leaders who come here, they bring a lot of experience along with them. And speaking of which, one of the part in your journey which I see is both the entrepreneur and the doctor, somewhere talking to the engineers towards the path of making medtech more accessible, more the more innovations coming in. So I see in your experience in the hospitals, you have experienced both the frustration of the wrong technology probably coming in and the promises that innovations are giving towards the medtech. So, what specific moment did you feel that there's something broken between the technology and the medical essence of it?
Um, it's, I think, a bit difficult to point out one specific moment because it was a reoccurring theme, which was felt not only by me but by pretty much everyone working in healthcare. I think with me specifically, it was a bit more prominent because I
Mhm.
had already at that time access I was already consulting in MedTech. And the specific problem was that I was on one side in a world where it's about innovation, it's about really making the most out of the capabilities and possibilities that the technology that we have and that we're developing, the impact that the technology that we're developing can have in a clinical setting. On the other side, I was spending my days in the ward, basically on the front lines, and not seeing those um, extremely powerful solutions reaching the bedside. So what I felt is that there is somehow dissonance between what, let's say, Silicon Valley wants us to believe, how everything is incredible and how incredibly fast it's moving. But on the other side, on the bedside, you don't see this impact coming through.
Mm.
So what I found being the problem specifically was that the logic that the startup world was following was more of a Silicon Valley logic, more of an
Mm.
industry logic, while the healthcare system itself is an extremely complex and inert system which is resisting innovation, so to say. Not because it doesn't like innovation, but innovation comes with certain risks with it.
Yes.
And healthcare is all about avoiding risk for the patient in the first place. So, out of that came a frustration, which ultimately led me to fund the EvoMid.
Right. And I think a very right point to start off something which actually creates value and differentiates what works and what doesn't work. How does Evomate, like as a name came in, like what's behind Evomate?
Um, yeah, well, EvoMid, the idea was what we were looking for is a name which really represents what we are trying to do for healthcare or for medicine, and that is to evolve medicine from what it is today into the best possible version it can be in the future, which is the
Mhm.
reason why it's called EvoMed, so evolve medicine.
Right,
That's
right.
also why the M in made is a capital M.
A capital, yeah, yeah,
Yeah,
right, right.
because the idea is really to try and communicate. The idea is to communicate this evolved medicine into the best version it can be.
Mm. I think that's where your determination lies, right? The problem to solve. Uh, and you have been mentioning in your feature that the medical technology or the medtech first needs to serve the clinician before it goes to the patient. So, what does it actually mean in everyday clinical life?
So the what I came across, and one of the reasons we were so me and my colleagues were so frustrated with so many medical devices and medical technologies, is the fact that um, it might have been thought from uh, very thought through from a development perspective.
Mhm.
But the clinical logic in a workflow, how a clinician does things, does not necessarily was not necessarily reflected in the workflows which were integrated or which were made, which the solutions were made for. So ultimately, what we find ourselves doing every day is to find workarounds in systems to in order to be able to uh, do our work the most effective way possible. What that does is introduces additional risks before because we are
Mm.
using medical technology, MedTech
Right,
tool, so something which is regulated and impacts lives in a way that it's not necessarily intended to be used in. So what I mean with it needs to cater the doctors before it can cater the patients is that even though the patient is the end recipient of the solution, it still goes through the doctor because the whole access
right.
to healthcare, the interpretation of all the findings, everything which is everything or most of the things that those tools do is actually going through the doctor. So if you want to make a tool which really gets clinically adopted, it needs to cater to the needs of the medical professionals, of
Right.
the those who deliver healthcare services in order to reach the patient in a safe way. I like to call MedTech a B to B to C business. So
Mm.
very rarely it is a direct to
Good,
consumer. So
right.
very rarely it goes straight to the patient, but
Mm.
mostly it takes a spin through the doctor, and that's why the whole path needs to be catered, not only the beginning and the end points.
True, true that. And when we talk about tools, in Silicon Valley, around the world, we have seen, right, like very brilliant medtech tools shutting down, not reaching in the market just because doctors somewhere did not adopt this tool. So, what went wrong there? And what is it that founders need to somewhere think of before going into a prototype?
Um, it's a very good question. It's a multi-trillion dollar question, I would say. I think one of the problems with the Silicon Valley thinking is thinking of healthcare as an industry. Healthcare is in fact a system which has one goal, and that goal is universal all over the world, and that is ultimately to help the patients, help those who
Hmm,
receive the care.
right.
Um, if you uh, if you handle medtech like an industry, you will not reach adoption because the complexity, the stakeholders involved, the regulations which are involved make the fundamental system logic way different from what you would find in the open market. And those who understand that and those who cater to those specific success factors or constellation points, as we call it in the EvoMed, are the companies which ultimately reach the bedside, while those who treat it as an industry, as something to be just like shipped or rolled out,
Mm,
like you would do with any other SaaS tool,
right.
they encounter resistance from the system. And
Correct.
ultimately, it comes down to aligning your solution to clinical reality so that clinicians, just like myself, can adopt those solutions without having to use all those workarounds mentioned earlier.
True. When we see the medtech tools coming in, so of course, from your lens and from a person who is not a doctor, uh, so for this sake of this conversation, I say, for example, if I'm a patient, right, all I trust is that tool, but more than that, I trust the person who is actually gonna use it, the person who is go actually going to analyze what comes in out through those tools. So what is the latest tech in medical technology, or what are these latest tools which you are currently somewhere working with, or it's something which is evolving in the industry? Let me not call it industry again, but yeah, somewhere that tools are now coming up and which were actually required to fight the kind of diseases which have evolved during the years. So what are these tools, any tools that you are working around with?
Well, I think the thing that comes to mind right away when talking about technology or medtech is, of course, AI and everything that is in that space. But AI is a very it's a very wide topic. So,
Mm,
first of all, I like to think of AI as augmented intelligence. So, not something which is autonomous and makes decisions for us, but is something which helps the human side um, augment their decision-making process. So present the information that is necessary at the time which is necessary in order to make the best decision possible. And that being said, this is pretty much the definition of clinical decision support systems.
right.
There's other tools which are in the market which are used right now, like for instance AI scribes or ambient scribes, which help reduce the workload of the doctor
Okay.
simply by helping the automizing the documentation. But to come to the point earlier that sometimes we have the feeling it is not made for us to use, is that also those medical scribes, for instance, they sometimes don't follow the clinical logic. One example, I use an AI scribe in my private practice, but there are still challenges involved. Sometimes
Right.
it doesn't understand properly what is being said, specifically if
Mm,
there's discussions in multiple languages. So if I switch from German to English to, let's say, Bosnian and talk to the patient in multiple languages, simply to understand him the best way possible, those AI scribes have problems. If I, for instance,
mm.
want them to use my voice, my tone, I have not found any AI tool which I can basically say, okay, I want you to output this specific format. I
Mm,
understand the limitations. Of course, they have to make sure that their solution performs to a certain level. And if
right.
you give the user the opportunity to switch up and change up whatever he wants, the system or the tool might encounter problems and not be able to deliver as it otherwise would, basically out of the box. So in the end, we are still in the beginning there.
Right.
There is a lot going on, a lot of exciting changes, um,
Right.
exciting dynamics, but we're still very, very early in the process.
Mm,
Going from AI scribes to the clinical decision support systems to imaging interpretation, so CT
mm.
or radiology imaging in general, to pathology imaging. All of these are very exciting fields where AI will make a huge impact soon.
Uh, uh, it's from a layman perspective, again, it all drills down to precision because the kind of treatment that happened to use in 90s, right? A patient and a doctor relationship somewhere. So comparatively today, uh, AI, of course, we see daily basis. There are dynamic changes which are coming in. Today, we feel that, okay, it's already doing 100 things, but tomorrow it's coming up with something additional which we never thought of. So it always, yeah, of course, excites us also from the augmented intelligence perspective. But yes, the part of augmentation that you have mentioned only comes from a clinician, a doctor's perspective, because what we use, it's more from artificial, which actually is being used around the world. So, speaking of that, how does your specializations make you more vulnerable to use the AI as a tech platform and integrate in Evomed to consult it to the fellow probably co-founders or fellow engineers, colleagues. So the specializations that you have from your doctor's space or lenses.
Um, so I think being in a critical care setting shows you what are the points where things can go wrong. Ultimately, when you implement a technology like this, or any technology whatsoever, when you work in healthcare long enough, I think depending on what point in the patient care journey you sit, you see what can go wrong, and the more the more you sit at the critical care, high end care side, the more aware you are where things can go wrong. So I
Mm,
think
right,
specifically my specialization in intensive care and pneumology, long-term ventilator treatment, makes me specifically careful in trusting anything which is automated. Because we've seen things go wrong, everyone trying to do their best, but still somehow there is a huge chain of things going wrong so that in the end patients take harm and land in the ICU. One lesson to take from that is the simple law: whatever can go wrong will go wrong. And if you design your solutions based on that, you automatically um, take out a lot of possibilities, or you automatically eliminate a lot of possibilities of foreseeable misuse, of
mhm,
misinterpretation of data, of similar um, risk, of similar risk areas, which ultimately is also part of the regulation process of medical devices. So if we talk FDA or MDR, they you are obliged to specifically design with safety in mind. One thing to mention in this is that safety and regulatory are two different things, right?
right,
Um, Regulatory is often seen as like a finish line to something, but the only thing that regulatory actually does is it's supposed to help you think through the risk layers that your solution introduces.
Oh,
So ultimately, if you design with patient safety in mind, you will have easy way through regulatory. And the other way, if you design for regulatory only, then you might miss certain important things when it comes to commercialization strategy, for instance. So I'm a huge fan of not thinking sequentially through these problems, but
mhm.
thinking through them as a whole, which is ultimately the essence of the StarMap framework that we developed.
Right. So speaking of the EMC star map, right? That's something which has been now built at your end, and it gives innovators a bigger picture to look at. So, if you can tell me something about the star map, how does this make the pathway for the innovators as such?
So what the star map does, it's pretty much a constellation of success factors in healthcare derived from research that I did. And it shows how specific factors like specialization, cooperation, predictability of services, quality of care, and so on interact with each other in order to produce a solution which checks everything which is necessary that a hospital or a doctor or anyone using the solution automatically would say yes to it.
Okay.
It is a knowledge graph, or looks like a knowledge graph, um, or it is a knowledge graph which looks like a star constellation, which is the reason why I named it that way, or one of the reasons.
Star map.
Um,
Hmm.
yeah, exactly. But what it's actually doing is it helps understand. It gives a 360 view of the challenges that medtech startups are facing in the healthcare space. And
Yep.
those challenges are more than just regulatory or more than just solving a clinical problem. There's many more layers to it, from economic viability through implementation friction. So just as an example, you can have an extremely specialized solution which definitely solves a clinical problem. But if it is so difficult to implement your solution into a real life setting, people will naturally block it. They will not accept
Hmm.
the solution in everyday life. And that is just one of the lessons and one of the things that the StarMap helps medtech companies with, along pretty much aligning all of the stars in order to succeed.
I also came across a star map and around this award that you got in, the Rising Star Award at the MedTech World. So, what was this award about?
Um, yeah, it's something I'm very proud of. I've been awarded Best Rising Star in the industry. And what that for me actually means is that MedTech is heading into the right direction. Because in my opinion, or how I feel about it is, of course, it's a personal recognition for me, but then again, I'm representing a very specific way of thinking about health tech or
Hmm.
medtech, both, in fact. And that is that it's built for humans. I understand that it's technology, but the goal of this technology is ultimately to help people. And that award, for me personally, was a huge recognition, a huge honor, but also a signal that the medtech industry is thinking about the general good of humans and patients, and not just about startup companies, and not just about valuations, and
Right.
not just about investors, and not just about funding, but the real core of this whole industry is to help patients. And yeah, very proud of that award.
I see, when the award comes in, I see it's promising because I'm talking to a doctor who's talking technology, right? So we have this persona of doctors wherein at least I have seen doctors speak on very specific things. They would try to speak to you on your uh, problems that you're facing related to the healthcare issue that you might have gone to them. But as a consultant, it's a different journey, right? You need to dig out things and then accordingly guide the other side of the table. How are you managing this? What does your work-life balance meter looks like? How is family taking this up?
Uh, I am very lucky when it comes to that. My wife is a doctor as well.
Uh-huh.
Also still practicing. At the moment, she's mostly taking care of our child. But I think we managed through being in these multiple worlds to really still stick together. For instance, very there's a very moving picture for me when it comes specifically from the award night. In fact, my wife was supposed to be there, but our little daughter got sick. So she stayed in the
Mhm.
hotel with her, taking care of her while I was at the awards gala. And as my daughter was sick, she was not really moving much, was just, yeah, a bit lethargic. But when it came up, when the award came up, and then I went up on the stage, and the camera was rolling. That was the only time in the evening where she got up. She went
Mm,
to the television, and there's a picture how she's pointing on at me on the screen.
right.
So
Uh-huh.
that is actually what why I decided to add entrepreneurial part to me being a doctor, and that is simply to manage to get my whole family involved into what I do every day and what I'm passionate about. And the whole entrepreneurial side gives you the a specific flexibility to do that. I cannot take my kid to work in the hospital. Um, from organizational problems to the fact that it might be dangerous for the kid because of all of the
Mm,
bacteria around and similar.
right,
But when I travel, when I am somewhere in this world, when it comes to MedTech, to entrepreneurial side, the whole
right.
family can come with us. So
True.
I'm a huge fan of family companies, um, of family businesses, and this is what I want the Avomate to look like as well. And with the longer the journey goes, the closer we get there to
Good.
be to involve the whole family.
Interesting to hear this from an entrepreneur who is working around the clock somewhere. So, coming to a point wherein, because you have been working around with lot many entrepreneurs yourself, I hear you saying the word disruptive to be taken cautiously in medicine. So, how does this uh, gels with how innovation is happening in the medicine as a space?
So there's this thing about innovation, again, like a Silicon Valley type of thinking, that innovation needs to be disruptive. Now, disruption, be fast and break things. That's their mantra. But when you look at it in a healthcare setting, breaking things and being disruptive is a risk. The whole system, healthcare system, is designed in such a way to minimize risk for the patients. That's why disruptive innovation is not something that can be practiced in healthcare. Way better is to think of it as a gradual improvement, which goes steadily into the right direction, than something that comes and disrupts. So imagine uh, disruptive new technology being in the hospital and
Mm,
someone of your family getting sick and is the first patient who is being treated with the help of a technology where
right,
the users don't have much experience with, where the users cannot rely on their past experiences in order to provide the best possible care because it's so disruptive. We have seen how this goes. For instance, in the example of IBM Watson Oncology, it was extremely powerful technology
mhm,
meant to revolutionize how we think about oncology and cancer treatment. But in the end, it was so far away from how doctors did things at that time
right,
that it did not work at all, and ultimately they ended up selling it away. Um, so what I want to say with this is that healthcare is a very special, risk-averse setting for good reason, because we're trying to safeguard our patients. And for that, we cannot break things. There we need to improve workflow in such a way that it feels like a natural evolution, just like the Evomid name would suggest, way more than like a disruptive change.
right, right. And uh, sometimes just because it's disruptive, it doesn't mean that it's actually gonna work in a real world.
That
Uh,
is better.
True, yeah, and that's where it also gives you goosebumps when you told that, it's the first time when a technology is being tried it is being tried over a patient for the first time. I don't know how the family would feel, but yes, it's kind of a responsibility that gets carried because it's not a simple application which has been there as an aggregator platform. It's something which can uh, take your life to the next day, or probably it can, just save another day of yours. So how are you, being so updated with what's going around? Is there something which you have been working upon? Anything newer than EvoMed?
Yeah, well, being in this whole industry and talking to so many founders which have these brilliant ideas, I think keeps you up to date off the bat. I am in the lucky position to learn about things which are being developed oftentimes way before the general public learns about it. So that's why it feels to many that I'm like a step ahead or two steps ahead. Now, for us at Evomed, this is we're very honored to be involved, because ultimately what we want to do is we want to help create a world where no where every patient is getting the best care imaginable, independent of their geographical location or economic abilities. And I think MedTech is the only way in which we can democratize knowledge and quality of care to a worldwide audience. So ultimately, I think that MedTech and the whole AI topic and similar will touch everyone's life. And I see it as my personal responsibility to help develop it in such a way that it is developed with the patient's best in mind,
Right.
and safe for everyone involved.
Correct, correct. Uh, Evomed, as such, itself is a concept wherein this links to a lot of lives because what you consult today goes out probably tomorrow at a patient's next door and being used by the doctors. So, what else than a movement? Like, of course, your practice, consulting. Are you working on something new at your end? Anything which is coming up?
Um, well, not specifically. There is one thing where not completely new. There is something which is combining all of these things, and that is a book on the success factors in healthcare.
Okay,
Um, Nothing new per se. I've been talking about this a lot, but I think the book itself is a very comprehensive read, which is intended to carry this mission that I talked a second ago to as many people as possible. Um, of course, it is. You can reach a lot of people through different formats.
true.
There's a lot of people who watch podcasts. There's a lot of people who like to read. And
Right.
in order to get this mission, this way of thinking out in the world. I'm finishing the book right now. We are in the last steps. So one thing that everyone listening can do already is we on LinkedIn, but also on our website, is going to be there's going to be a link to a waiting list for the book.
Okay. Okay.
If there's anyone in the audience who wants to learn more about the success factors in healthcare and everything that we try to help with, and how we infuse or how I infuse my clinical knowledge into the medtech development, that's, I think, a great way to start.
You're gonna see me in the waiting list once we get this off. And this brings me to the end of this conversation. I would really love to get back onto more topics, probably in the next conversation that we put up. But what is your advice to the young doctors, entrepreneurs, engineers who are gonna watch this podcast for a better world that you have the mission to build upon?
um, I think a good advice would be to understand that healthcare is an extremely complex environment with a lot of stakeholders who have a different perspective on things, but ultimately, I think they have the same goals. And more than trying to push a certain way of looking at things, or like push it through with force, I think a collaborative approach is the way to go. Because if you think of healthcare more than just like the simple act of delivery, you see that there's also more challenges which need to be tackled. If you start with the costs, let's say,
Right.
someone has to pay for it. So naturally, a solution or a way of delivery needs to be in such a way that it reduces costs for everyone involved, so that we can give healthcare to more people, and not just a small number because of the high costs. So ultimately, what I would like everyone to understand is healthcare is a complex environment. The real success metric in healthcare is clinical adoption, and clinical adoption is about more factors than just one. Actually, it's seven. And if you want to learn more about that, you can read up in the book.
Great. It was great conversing with you today, Dr. Amel, and thank you so much for coming in over this podcast, speaking all about the medtech and the experience you have been getting over this journey. Looking forward to the book which is coming up. Uh, you will see me in the waitlist, and I'm going to see you in the next conversation that we have. Thank you so much again.
Thank you so much. Talk to you soon.
Yes, thank you.